Hello, I'm Dr. O, and before we dive into the actual material regarding the eating plan, I want to address one thing. We have patients asking how much of the eating plan should they follow to get the best results. The percent in which you follow the eating plan is the percent in which you can expect results. How much better do you want to be? We are here to help you every step of the way to make this transition easy and smooth for you. We will be providing you with tools and resources. Both our doctors and all of our technicians are knowledgeable on the material. We will be providing you with a nutrition log so that we can help you every step of the way. You will bring this with you each office visit so we can be on the same page and so you can get one-on-one time with us. We want to help you with all nutrition wins and challenges. We want you to know that we are here to help debug any possible problems and help come up with alternative ideas. We will also be providing you with a simple one-page eating guide for your fridge. This is an easy cheat sheet with foods to avoid and foods to eat more of. We make this easy to put on your fridge for you to use as a daily guide and reminder. The goal of our eating plan is not weight loss. This is not a fad diet that you stop after you leave us. This is a lifestyle change to eliminate inflammation and increase your quality of life. Who here likes dieting? Not many people. Today we will be going over our new eating plan. We do not call this a diet because it's not a temporary change. It's a healthy lifestyle that you will be following, making changes one day at a time. We will be going over the reasons why we make these changes easy in your daily life. The number one reason why this is necessary to seeing results from your treatment is to decrease inflammation in the body. What does inflammation do to your body? Increased inflammation will cause decreased blood flow in the system. This can result in neuropathy and a number of other serious conditions. How many of you are on medications such as blood pressure, cholesterol, diabetes, etc.? The majority of the population is unfortunately on at least one or a few of these. Our goal is to decrease the dependency on these medications, which are harsh on the body. They have side effects, which we will discuss. The goal is to clear the body from toxins and make the body a healing environment to allow the nerves to respond better to the treatment. Here's the big picture of the inflammation that I will constantly be talking about and why we care so much about this. This top blood vessel is a healthy vessel with wide and open walls. It is getting a good amount of oxygen passing through and supplying the system. When the walls get thicker due to inflammation, how do you think the blood can get through this one versus this one? Not that good. If this is constantly inflamed due to a bad diet, grains, sugars, and bad lifestyle habits such as smoking and excessive alcohol consumption, then we see heart disease, neuropathy, peripheral artery disease, and other circulatory problems because of inflammation. Now, in regards to circulation, there are different types of blood vessels. There are big arteries such as the abdominal aorta, femoral arteries, and many more. In the case of peripheral neuropathy, the small vessels start to break down, not the big ones. Picture a tree with a big trunk, the big artery. They branch off to limbs and even smaller twigs. So when we talk about microcirculation causing peripheral neuropathy, we are talking about these small vessels, the capillaries. This is what causes the harmful inflammation. It is these small blood vessels that are affecting your microcirculation and helping to cause your symptoms. So what should you be eating? Protein, seafood, fruits, nuts, seeds, vegetables, healthy fats, and oils are all examples of wonderful healthy. The recipes we will be providing you with give you ideas on how to prepare these in so many different and delicious ways. Now you may be wondering why some of your favorite foods are not on this list. We will get to that. There is a reason that you are here in our office. Your body needs help healing. We are here to help you make that change. So what have you been eating that has contributed to your condition? You may be eating foods that are causing inflammation in your body, leading to one or several different chronic conditions. We will now identify those foods and provide alternatives for you. Let's start with the grains. In the 50s and 60s, we started doing hybridization. Hybridization means taking two molecules and adding them together to withstand harsh weather, bugs, make more crops with less money to be more profitable. Unfortunately, they never tested them for the human GI tract, and now we are seeing all these issues with the human GI system, such as gluten sensitivity and other problems. Gluten is not the problem here for us, but we are staying away from grains in general. I don't want you buying gluten-free bread loaves because even those are packed with all types of starches that cause the same reaction in the body to spike up the blood sugar and cause problems. Any carbs that you intake turns into sugar in the body and spikes up the blood sugar. That is why we are eliminating pasta and substituting it with spaghetti squash and zucchini noodles, and limiting rice consumption to only black rice in small amounts instead of bread. Try paleo bread. What? No bread? Yes, no bread or pasta or rice or corn. These are all grains that spike our blood sugar, cause inflammation, can lead to autoimmune issues and leaky gut syndrome. Also avoid white potatoes. What can you have instead? Paleo bread, black rice in moderation, and sweet potatoes. We understand that these changes may be difficult to make, but once you make them, you will be amazed at how your body reacts. How much sugar are you eating? Surprisingly, there is some type of sugar in almost everything that we consume. A recent study shows that the average American consumes about 130 to 160 pounds of sugar a year. This was not the case 100 years ago. Most foods we consume today are processed to stay fresh for a long time, and they are packed with sugar. Sugar is toxic to the brain. Studies show it is addictive and sparks up pleasure receptors in the brain. ABC Eyewitness News reports that sugar is 8 times more addictive than cocaine. The brain asks for more because once consumed, you have that feel-good chemical released that is serotonin. What else has a ton of sugar? Alcohol. Yes, all alcohol. Sugar is toxic to the body, but it is found in most foods and drinks as well. Let's get a visual on how much sugar we consume daily in juice, tea, and sodas. Let's talk about alternatives now. How about artificial sweeteners? Artificial sweeteners are neurotoxic, meaning they are basically poisons to your body. They cause a number of health problems listed here on this slide. The reason for that, they are artificial. They have high levels of aspartame that is toxic to the body. Some examples of those would be Sweet and Low, Equal, Splenda, and NutraSweet. A study conducted in 2008 at Purdue University tested rats exposed to yogurt sweetened with sugar versus yogurt sweetened with artificial sweetener. The rats exposed to the artificial sweetener gained more weight, put on more body fat, and were prone to overeat, and were unable to reverse these effects when they cut back later. Your body recognizes that it should eat sweet food in moderation and is built to recognize sugar, not artificial sweeteners. So, no more sweeteners in my coffee? You can still sweeten your coffee, just with something that your body actually recognizes. So what are some natural alternatives that we can incorporate in our diet? Stevia is the best type of sweetener that is a South African plant and now is being used as a sweetener. It is all natural and does not spike the blood sugar and cause inflammation. It comes in different forms like Truvia and can be found anywhere. Another great substitute is raw organic honey. What types of fruits should you have? Since fruits contain lots of sugar, to make this simple, we are leaning toward the berries. All berries are great. Strawberries, blueberries, raspberries, goji berries, blackberries, boysenberries, etc. They are high in antioxidants, which means they detoxify the system for better healing. Cherries are also low in sugar content. As far as apples, we stick with green apples because of the sugar content. Bananas, they are high in sugar. However, if you eat unripe green bananas, the sugar content is actually half as much as a brown ripe banana. Avocados, believe it or not, avocado is a fruit. They have high amounts of omega-3s and good fats, which are great for nerve healing. We will provide you a list of fruits you can eat and which ones to stay away from, so that you can have an easy guide to follow. Dairy products have been the healthy choice for as long as we can remember. We were told that dairy products are a good source of calcium, good for the bones. So why would dairy be bad for you? Unfortunately, our cows nowadays are pumped with tons of antibiotics and hormones. They are fed corn, whereas before they fed simply grass and were naturally grown. Dairy products nowadays cause inflammation response and are acidic, which is not good for osteoporosis and bone growth and health. It causes intestinal inflammation, which causes the body to be unable to absorb any nutrients in the GI system. Also causes mucus secretion in other cavities in the body, which causes ear infection, tonsillitis, sinus infection, etc. Here are some great alternatives for milk dairy products. almond milk, coconut milk, flaxseed milk. You can buy these at any market. Make sure they are not sweetened because they do come in chocolate and vanilla flavors. Also, raw organic cow milk is another option. It is organic, which means the cow was grass-fed and free of hormones. Also, it did not go through pasteurization process. Is soy milk okay to drink? Soy products are the most genetically modified products that we have now. It causes inflammation and interferes and aggravates the system. It causes hormone imbalance in our body as well. So we are to stay away from soy products, soy milk, tofu, soybeans, etc. How much water should we be drinking a day? 8 glasses? It's different for everybody. The right amount of water that your body needs depends on your weight. To make this simple, it should be half your weight in ounces. If you weigh 100 pounds, you should be drinking 50 ounces a day. If you weigh 200 pounds, you will need about 100 ounces a day. The human body is made up of 75% water. Our blood contains 82% water. We need to stay hydrated for faster healing. Other beverages will not replace water. If plain water doesn't excite you, feel free to add berries or citrus slices. Do you know cholesterol is necessary for a lot of functions within the body? These include brain function, nervous system repair, hormone regulation, and digestion. The reason that we care about this is because cholesterol is necessary for the nerve function. The outer layer of nerves, the myelin sheath, is made up of fats and cholesterol. If you don't have enough of them, they'll start to break down. The way we have controlled this is to medicate ourselves. The majority of the population is on some type of statin now to lower their cholesterol levels. These medications can unfortunately cause nerve damage and contribute to your neuropathy. If you are on any statin medication, Lipitor, Crestor, Zocor, or many more that end in statin, you may want to have a talk with your doctor to consider lowering the dosage. Eventually, after following an anti-inflammatory lifestyle, your test results should show a drop in your cholesterol levels. This can result in you reducing or maybe no longer needing your cholesterol medication at all. This happens almost daily with our patients simply by following the eating plan. Some supplements that we can take to help ourselves to faster healing would be vitamin D, coenzyme Q10, and omega-3s. Let's talk about them in more detail. So here is a little bit more about coenzyme Q10. Our bodies make coenzyme Q10 and our cells use it to produce energy for cell growth and maintenance. It repairs damaged tissue and it acts as an antioxidant to protect our cells from harmful molecules. Did you know that coenzyme Q10 is what protects the myelin sheath on our nerves? We recommend patients who are currently on statins to add coenzyme Q10 to their daily supplement intake at a dosage of 200 milligrams per day. Omega-3s. Omega-3 fatty acids lower blood pressure in people with hypertension. They help level out cholesterol levels, decrease inflammation, and repair the damaged nerves since the outer layer of our nerve, the myelin sheath, is made up of cholesterol. We can find them in a variety of foods. They are potent in most fish and seafood. For those of you who do not like seafood, no problem. They can be found in flax seeds, walnuts, coconuts, chia seeds, etc. Or you can simply take fish oil supplements from any stores. Superfoods are the types of foods that are nutrient rich and are beneficial for faster healing of the body. Some examples are chia seeds. Chia seeds are rich in omega-3 fatty acids that help with nerve healing. You may incorporate this in your diet by either simply drinking it mixed with water or adding it in breakfast or salads. Coconut oil is a great substitute for cooking. It is great for brain function and overall health. Flax seeds are great for digestive system because they are high in fiber. They are very rich in antioxidants and they help fight heart disease, cancer, stroke, and diabetes. Other examples of superfoods are goji berries, kale, spirulina, and acai berries. Make any of these that are accessible to you part of your daily diet. The crock pot. We want to make this as simple as possible for you. We understand that with neuropathy, standing for long periods of time and cooking is not a simple task, especially if you have to take care of other obligations such as grandkids, jobs, and attending to other doctor's appointments. So here's an idea. Gather all your ingredients and then sit down and chop them up. We will provide you with several crock pot meals as well as to help in this area. We have great recipes for different types of breakfast ideas in our recipe book. Most of them are egg-based. These include various types of omelets with or without bacon or other meats. For patients that don't like eggs, we also have great options. Oatless oatmeal, paleo cereal with almond milk or coconut milk or paleo pancake mix. These can all be purchased at either paleo stores or websites. Paleo bread makes a wonderful bread toast replacement. These are grain, gluten-free, and can be flaxseed bread. Coconut bread and almond bread. Stores such as Whole Foods, Sprouts, and several websites make these easy to obtain. The most cost-effective way to eat these breads is simply to make your own. It's fun, cost-effective, and allows you to get creative. Paleo crackers from our great recipe book or the store make great snacks. Other great examples include nuts, trail mix, berry fruit salad, root vegetable chips, and seasonal veggies. All meats are allowed. Fish and seafood. We want wild-caught fish. Farm-raised fish are pumped with hormones and antibiotics. These chemicals and hormones cause inflammation, have less nutritional value, affect your own body's hormone levels. Look for wild-caught fish. As far as beef, choose grass-fed cows. Again, corn-fed cows are pumped full of antibiotics and hormones, which we do not need. Chicken, cage-free for the same reasons. Again, we need to stick to water. Flavor it if you need to with citrus or berries. For those who prefer soda, try replacing sodas with Perrier or Pellegrino. For those who like chocolate milk, try unsweetened cocoa powder in almond or coconut milk. If you prefer sweet, try honey or stevia. We want you to understand that this is a lifestyle change. The nutrition plan is so important in conjunction with your treatment to help heal your body and maintain that healthy environment. We are here to help you get started and make these changes with you. We are all here for you, but you are responsible for your own part at home and away from the office. We will do our part, and we will hold you responsible and accountable for your part. We are in this together as a team for you. Should I stop taking my medications? No. Take your medications as prescribed. They're there for a reason. The only one who should take you off those medications would be the one who gave them to you. Can I have tea? Yes, you can have tea, but there's a caveat to that. We recommend that you go with green tea. Green tea is rich in antioxidants, which helps clean out free radicals in your body. And please avoid the sugary sweet teas. Can I have butter? Yes, you can have butter, but make sure that it's grass-fed butter. Grass-fed butter is healthy for you because we need fats in our diet, and that is a healthy fat from a grass-fed cow. Can I have beans? You can have beans, but we recommend severe moderation with the beans. What should I do when I eat out at restaurants? When you eat out at restaurants, try chicken, steak, fish, eggs, vegetables, and salads. Often I get asked, can I have fill in the blank? The answer is read the label. A few buzzwords we want to look for are hormone and antibiotic-free, grass-fed, and wild-caught.